Hello, my name is Consuela Thompson, and I'm going to be discussing medication reconciliation and electronic health record enhancement. Definition of the problem: medication reconciliation and variations that may occur between outpatient providers and inpatient providers. Patients sometimes lack the knowledge of medications they may be taking. Patient safety related to medication errors. Process of gathering and communicating medications is not always straightforward. Continued definition of the problem. Institute of Medicine's Preventing Medication Errors report the average hospitalized patient is subject to at least one medication error per day. 40% of medication errors are believed to result from ineffective reconciliation in handoff during admission, transfer, and discharge of patients. Intent for medication reconciliation is to avoid medication errors such as omissions, duplications, dosing errors, or drug interactions. Target population of discussion consists of the patient, the nurse, the physician taking care of the patient, the pharmacist, and the primary care physician. Current practice: the nurse and or the physician caring for the hospitalized patient collects information on all medications the patient is taking prior to hospitalization. There is comparison to the medication the patient was taking to the medication that is now ordered. Medication reconciliation should be done at hospital admission, transfer to other facilities, and at discharge. Proposed products: proposed enhancement of electronic health records with outpatient providers such as the PCP. Electronic network system linked to the PCP medication records of prescribed medication for their patients. Inpatient providers and outpatient providers to have the ability to view and update medications of patients within a single network. Cost analysis: direct cost, estimated cost of implementation of EHR in a primary care practice is about $32,409. Hardware cost: $25,000 per physician practice, $7,000 per physician for personal computers, printers, and scanners. Software and maintenance costs: approximately $17,100 per physician annually cost. Indirect costs: salaries per practice for efforts of the practice network's implementation team. Implementation: development of one network system of patients' prescribed medications. Mandatory that all outpatient physicians that prescribe medications to patients have access to this network and update medications as prescribed or as the medications are discontinued. Healthcare providers having the ability to access this medication network by entering patients' social security number, which would be their identifier, to access their specific medication records. Policies and procedures: a combination of federal government oversight and industry action is necessary to avoid unintended consequences from electronic health records. Federal regulations is needed to ensure development, implementation, and enforcement of national standards for the design, performances, and use of EHR systems that reduces EHR-related errors. Healthcare providers should implement policies and procedures that address proper electronic health record training and use to prevent errors related to systems use. Research the results of effectiveness medication reconciliation when hospitalized patients don't recall the medications they were taking prior to hospitalization. Marketability: market: the hospital is introducing the enhanced electronic health record technology to inpatient physicians, nurse managers, and pharmacists, showing results of the previous mentioned study showing reduction of issues with medication reconciliation. Market the PCP practices by showing them the safe outcome patients would have if all prescribed medications of the patients could be confined in one network, and all healthcare providers would be able to access a particular patient's medication records. And rally nurses association behind the one network medication keeper. Thank you.